All right. Hello, everyone. I'm Brittany and I'm with Nikole. Today, we'll be discussing reactive attachment disorder, also known as RAD. Our presentation will explain what RAD is, how it develops, how a professional assesses it, available treatments, and an evidence based intervention that families, schools, and clinicians can use to improve outcomes. Okay? So, for starters, what is reactive attachment disorder? Reactive attachment disorder is a trauma and stressor related disorder found in the DSM 5 TR. It occurs in young children who have experienced severe neglect, abuse, repeated changes in caregivers, or institutional care where emotional needs were not consistently met. Okay? So, because these children did not develop secure attachments with caregivers during early childhood, they often struggle to trust adults and regulate emotions. DSM 5 diagnostic criteria. So, children with RAD typically do some of the following: rarely seek comfort when upset, rarely respond to comfort from caregivers, display limited positive emotions. They may appear withdrawn or emotionally attached at times. They can also be fearful, sad, or irritable without an obvious cause. The symptoms must begin before age 5, and the child must have experienced significant neglect or insufficient caregiving. Okay? So, also, we will discuss behaviors across development. Infants and toddlers. So they could possibly avoid eye contact. They do not seek comfort, delayed emotional development, limited smiling, and difficult being soothed. School age children. They have difficulty trusting teachers. They withdraw from peers. They have poor emotional regulation, trouble following directions, and low empathy. And in adolescence, they have difficulty maintaining friendships, anxiety or depression, emotional numbness, problems forming healthy romantic relationships, increased risk taking behaviors. Now, although RAD is diagnosed in childhood, untreated attachment problems can continue into adolescent and adulthood. Okay? So, next we will discuss assessment tools. All right? So, there is no single test for reactive attachment disorder. Diagnosis requires clinical interviews, observations, and developmental history. So, two commonly used assessments include the following: disturbances of attachment interview, also known as DAI, and also that will interview caregivers, evaluate attachment behaviors, and help distinguish RAD from autism or anxiety disorder. The second one is called Randolph Attachment Disorder Questionnaire, also known as RADQ. And so, with this one, the parent questionnaire measures attachment related behaviors used alongside clinical evaluation. So, clinicians also gather medical history, abuse and neglect history, school reports, behavioral observations. Okay. And now I will turn it over to my partner, Nikole.
Hi, I'm Nicole. I'm going to talk about the medications for RAD. There is currently no medication that directly treats reactive attachment disorder. However, medications may help manage symptoms that occur alongside RAD. Examples include SSRIs, known as Prozac, and the generic brand, I believe it's called fluoxetine. I'm probably mispronouncing it, and Zoloft, and the generic brand is sertraline. And that's normally used for people with anxiety and depression, but there are side effects. Some of the side effects could be sleep disturbances, nausea, increased suicidal thoughts in the young youth. ADHD medications are also another notion of the medications that are provided to the RAD students and adults. Adderall is a very common one. The other one, forgive me, I'm going to mispronounce it, methylphenidate. It starts with the METHY. And this is only used if the ADHD is diagnosed. There are possible side effects: appetite loss, insomnia, and irritability. Be irritable, sorry. Atypical antipsychotics. Examples of that would be risperidone and aripiprazole. Ripiprazole, sometimes prescribed for severe aggression. Possible side effects for that, unfortunately, this is not a pretty one, would be weight gain, fatigue, and metabolic changes. Medication alone does not treat RAD and should always be combined with therapy. This is a must. Evidence-based intervention. The intervention we'll focus on is attachment-based family therapy, also known as the acronym of ABFT, combined with trauma-focused cognitive behavioral therapy, which is very popular. It's also known with the acronym of TF-ZBT, when trauma symptoms are present. Research shows that these approaches improve trust, emotional regulation, parent-child attachment, and behavioral functioning. These therapies help caregivers respond consistently while teaching children healthier emotion coping skills. Evaluation success in different settings. So we'll start off with the home setting, and this is where parents are in charge of monitoring the comfort seeking, emotional expression, daily routines, and parent-child interactions. In the school, the teachers would observe classroom participation, peer relationships, emotional regulation, and behavioral referrals. In the community means the therapy. The therapist can evaluate social interactions, family functioning, participation in any type of activities, and emotional well being. Why this intervention works? Attachment based therapy addresses the underlying cause of RAD instead of simply managing behaviors. It teaches caregivers how to respond consistently, build trust or rapport, and create emotional safety. In turn, the children learn healthy relationships from a young age, and they begin the skill level of having emotional regulation and communication skills, which is very important. Research indicates children who receive early intervention experience significantly better long-term emotional and social outcomes. And that's very important in the working world or voc rehab world, especially Brittany. I work with those children that are disabled, and children meaning teenagers, ages 14 to 22. And there's also optional role play. So, for example, a student, I think Brittany and I are going to play this. So, Brittany, you want to be the caregiver and I'll
Okay.
be the child? Okay. So, she's going to go ahead and ask a
All
question.
right. So I notice you're upset. I'm here with you whenever you're ready.
I don't need you.
Well, that's okay. I won't force you to talk, but I'll stay nearby because you're important to me.
You'll leave like everyone else.
I understand why you might feel that way. I'm staying with you and we'll work through this together.
And now we're going to talk about the conclusion. And Brittany, you're up for this one.
All right. Reactive attachment disorder develops from early experiences of neglect or inconsistent caregiving, making it difficult for children to build trust in relationships.
Early identification, trauma informed care, and strong caregiver involvement are the most effective ways to improve outcomes. Although medications may help manage related symptoms, therapy and secure relationships remain the cornerstone of treatment.
Okay.
And we'll do this together.
All right.
Thank you.
Thank you for
Thank you for
listening.
listening. We'll be
We'd be
happy
happy to answer
to
any
answer any
questions.
questions. So we hope you liked our presentation. I'm not too sure we hit the 15-minute. I think we're right at 10 minutes, so don't ding us for any points. And we're here for any questions, or you can email us. Thank
Thank
you.
you.